The Nigerian Center for Disease Control and Prevention has urged health personnel to take their hand hygiene of utmost importance, as a hand hygiene is pivotal in maintaining clean and safe provision of care for their patients. The coordinator, Infection Prevention and Control, Antimicrobial Resistance National Program of the Nigerian Center for Disease Control and Prevention, Dr. Tochi Okwo, made a call during the World Hand Hygiene Day, commemorated at the Asokoro District Hospital, Abuja. Correspondent Lois Abasambo has the details.
The Asokoro District Hospital was abuzz with activity as the hospital staff gathered to commemorate the Hand Hygiene Day organized by the Nigeria Center for Disease Control and Prevention. The event was aimed at raising awareness about the importance of hand hygiene in preventing the spread of infectious diseases. In her opening remark, Coordinator, Infection Prevention and Control and Antimicrobial Resistance National Program of the Nigeria Center for Disease Control, Dr. Tochi Okwo, emphasized the importance of hand hygiene in healthcare settings, noting that it is imperative that everyone acts towards hand hygiene improvement to provide quality and safer climate for healthcare.
So to prioritize clean hands in health facilities, people at all levels need to believe in the importance of hand hygiene and the ability and capacity of infection prevention and control to save lives. And to do this, we must all collaborate by acting as change agents in creating a culture of safety. I must also emphasize that clean hands is a sign of respect to those we care for. It is also a sign of respect to our colleagues.
Also speaking, Medical Director of the Asokoro District Hospital, Dr. Uche Afioma, who was represented by the Head of Clinical Services, said hand hygiene is a simple but effective way of preventing the spread of infections. The hospital staff were also taught on the 5 moments of hand hygiene.
1. Before touching the patient. 2. Before clean or aseptic procedure. 2 befores, then 3 afters. After touching the patient, after touching patient surroundings, or after risk of body fluid exposure.
Speaking to journalists after a tour of the hospital, stakeholders called for concerted efforts and effective implementation of infection prevention and control programs across health facilities.
Even the high-income countries, around 65% or so, thereabout, in terms of compliance, the level they are. And when you come to low-income countries where Nigeria belongs, all you find is around less than 10%, 9.something%. So it tells you the disparity that low-income countries, Africa inclusive, we are not doing very well in terms of that. But however, our national average at the level of the Orange Network, when we collated the data last year, was found to be 25 point something. So you can say our national average at the tertiary and care facility level is above the low-income country average.
A patient comes with illness and he is attended by the doctors. We want to stop that practice that he comes and distributes and carries another one home. So by the institution of the hand hygiene, we bridge that disease transmission. The chain is broken.
The event featured several educational sessions and demonstrations on proper hand hygiene techniques. Lois Abasambo, ASO Television News.